every year the ACIP, which is the Advisory Committee on Immunization Practices of the CDC, revises and makes updates, and 3 times a year they do this. If you go to, I think, APhA and several of the other publications do updates for different vaccines throughout the year. I think probably just to highlight maybe 1 or 2, people have been asking about Tdap vaccination and revaccination. Right? And at the last ACIP meeting, they decided to not recommend any further Tdap vaccination for non-pregnant individuals. So you get 1 Tdap and then your subsequent boosters will be TD, largely based on cost issues. In other words, it's not very cost effective to keep giving Tdap if it's going to wear off every 2 years. So that was finally, well, not finally, but put to rest for right now. Right? Influenza, probably the biggest thing in there, 2 things. One is there's a new vaccine coming out that has an adjuvant. So none of our flu vaccine in the United States has ever had an adjuvant. This will be the first one marketed that has one. So we'll learn more about adjuvanted vaccines. Europe has experience with that, but we haven't had that in the United States. But it will only be for the 65 and over group. The idea being is to generate a higher antibody titer that they need in a person who's over 65. The other part is egg allergy. Pharmacists have been preoccupied with egg allergy. Everyone, it's top of your screening list, right? Is the patient allergic to eggs? It turns out that there's a very tiny amount of what's called residual albumin from the egg protein that's left in a vaccine, right? People who have anaphylaxis to eggs are incredibly rare, if non-existent. It's hard to actually even find that population. So the CDC finally looking at the public health implications of screening for egg allergy and people misunderstanding the egg allergy and not getting a flu shot versus the tiny infinitesimal risk of giving somebody who has a severe reaction to influenza vaccine that is allergic to eggs far outweighs that. So they're actually removing that. And what they really say is, as long as you're able to handle a severe allergic reaction, right, which means basically you've got epinephrine and you can call 911. If you can do those 2 things, you can take care of any of your patients in your pharmacy.